Hello, everyone. Welcome to the Waldenström's Patient Physician Partners Program. I'm Tiffany Drummond, a patient advocate with over 20 years of experience in cancer research. My journey as a care partner began when my mother was diagnosed with endometrial cancer in 2014. I quickly realized the challenges of finding reliable information to support her care, and I am committed to helping others avoid similar difficulties. That's why we at The Patient Story create programs like today's to help you figure out what's next. Think of us as your go-to guide for navigating the cancer journey. From diagnosis to treatment, we've got you covered with real-life patient stories and educational programming with subject matter experts. I truly am your personal cheerleader, here to help you and your loved ones best communicate with your healthcare team as you go from diagnosis through treatment and survivorship. I want to give a big thank you to the Leukemia and Lymphoma Society for its partnership in this. The LLS offers incredible free resources like their information specialists to help you communicate with members of your healthcare team and provide information about treatment options. And the IWMF, an organization specifically dedicated to Waldenström's patients and care partners that offers free resources as well as their in-person support groups. They have more than 60 worldwide. Before we get to our speakers, we want to thank our sponsor, Pharmacyclics and AbbVie Company, for its support, which helps us host more of these programs for free to our audience. The Patient Story retains full editorial control and all content as always. I hope you find today's program helpful. Please keep in mind the information provided in this program is not a substitute for medical advice. Finally, we know there's a lot you want to know more about and discuss, or at least tune into. Please let us know what those are, along with what we could do better. A survey will pop up after the program ends, so make sure you don't go anywhere. Now, the moment you have all been waiting for. Pete, a patient advocate and Waldenström survivor himself, will lead today's conversation. Pete, take it away.
Hello, everyone. I'm Peter DeNardis. I'm currently the chair emeritus of the International Waldenström's Macroglobulinemia Foundation. I've been a longtime volunteer for the organization, and I'm also a patient myself. I was diagnosed 20 years ago. So being a WM patient myself, I am well aware of and especially for so many years, I'm well aware of the importance of a strong patient-doctor relationship, and look forward to hearing from our esteemed panelists today about how best to build and maintain that relationship. With us is Dr. Jonas Paludo. He's a hematologist, oncologist, and assistant professor of medicine and oncology at the Mayo Clinic in Rochester, Minnesota. His research interests include studies to understand the biology, genetics, and therapy of lymphoma and plasma cell disorders. And he's also a noted researcher in Waldenström's. Let's start initially with getting a little bit of insight about the patient herself, Lisa, and hear from her about her journey thus far with Waldenström's.
Hi, so I'm Lisa Ramirez. I was diagnosed 3 years ago in 2021. I was just getting into a doctoral program and had to do some routine testing and physicals for that, and in the process was diagnosed with Waldenström's macroglobulinemia. The diagnosing oncologist was retiring, and so passed me on to another doctor in his practice. And of course, I did a lot of research on Waldenström's immediately, and read Dr. Gert's recommendations on getting a second opinion, which I really appreciated. And so I did so and looked for the doctor that I thought would be best in getting a second opinion. And that was Dr. Paludo, since he specialized in Waldenström's in young people. And I also got another opinion from a physician at a major cancer center in the state in which I live as well. And so I had a great rapport with Dr. Paludo immediately, but initially thought that perhaps I would not be able to, continue seeing him. Would only see him as a physician for a second opinion, just due to logistics, distance, living in Texas and he being at Mayo Clinic. And so, but it turns out that I was able to make it work to secure Dr. Paludo as my primary oncologist, and I was very pleased about that.
It's great. It's good that you did immediately research it and also went for a second opinion. Obviously, you were a involved patient from the start. Is that appropriate to say that?
Yes. I think I'm a natural researcher. I work in public health. And so I think that I'm a very curious person and wanted to learn as much as I possibly could, as quickly as I could, about Waldenström's to plan out my course of treatment and to, just be a well-informed patient. So I listened to all the lectures I could get my hands on, and tried to understand the different philosophies of the different cancer institutes. They seem to have differing philosophies about treatment, and tried to really find one that fit in with my personal philosophy and my, that fit in with how I wanted to approach treatment.
Right. So when you were looking back 3 years ago, do you think you had any symptoms that maybe you weren't paying attention to at the time?
I was having night sweats, and I did not even consider that to be a symptom. I thought I was having some early premenopause type of symptoms, and I now know the difference between hot flashes and night sweats. There's a big difference. I had even had some testing done for other reasons, and there was a note on those tests to rule out lymphoma and to check in 6 months. And right at that 6-month mark is when my primary physician had me see a hematologist due to those test results. So I had 0 symptoms. I felt great. And looking back, I had some input from other oncologists with the thought that perhaps I had the disease for so long that, perhaps I just thought I felt good. I think that, small incremental change in a negative way can maybe go unnoticed. And so I'm not sure, but I sometimes thought, well, what does it matter if I believe I feel good? Then I feel good. So
then I take it then you've been treated, you've received treatment?
I have. I think, the average time from diagnosis to treatment was about 2.5 years. And that's about exactly what it took for me. So I was right on pace with, I think, the average.
Lisa, when you mentioned that you had gone a second opinion in a different state because you live in Texas, so obviously Mayo's in Minnesota. Did you have any financial issues or insurance issues trying to work that out to be able to see Dr. Paludo?
Actually, surprisingly not. I had received some treatment in another city in Texas, and actually, when you break down the costs, that treatment actually ended up being more expensive. I think different institutions have different priorities in terms of testing and the amount of testing at checkups. And I think for me, the cost of the additional testing outweighed the cost of travel to Minnesota. So for me, it ended up being, in my case, more affordable to travel to Minnesota, and absolutely worth it to travel to Minnesota to receive treatment at Mayo Clinic for various reasons. It just ended up being more cost effective for me.
It's good. You're very fortunate in that regard. Glad that worked out for you. So obviously you're under some great care, and it appears that you're right from the start. You're sort of a poster child for the very involved, proactive patient. So I applaud you for that and hope that other patients can take your lead. I have some questions now, kind of turn it to Dr. Paludo. And just a general question here, kind of a softball pitch here. Many of us WM patients have a general idea of what Waldenström's macroglobulinemia is, but can you give a 30,000-foot view explanation of what the disease is?
No, absolutely. A 30,000-foot view, I would say that Waldenström's is a rare form or type of blood cancer, right? If we go down a little bit more to the details, or more specifically speaking, is a form of an indolent or slow-growing subtype of a B-cell non-Hodgkin's lymphoma. More specifically, is a disease that has some overlapping features between lymphoma and myeloma. But it's a type of blood cancer. It's an indolent subtype of non-Hodgkin's lymphoma.
And, obviously you see patients, whether it's a patient coming initially to see you or someone coming for a second opinion, they probably have similar questions. But in your experience, what are the more common or popular questions that patients ask you?
Yeah, absolutely. So I think I can summarize, at least group the most common questions in three specific categories. In one shape or another, they're usually trying to understand what is Waldenström's, what is this disease? Then the next one is, okay, then what do we do about this? Do we have to do anything about it right now? What does that look like? And then the third one, or third category, is that what is my prognosis? What can I expect out of this disease? Those are the three main categories of questions for Waldenström's.
Those questions are probably pretty common for Lisa and for myself when we were first diagnosed. So it's good to see those questions are still being asked, and that's natural. That's to be expected. But many in the medical community and even the IWMF itself encourage patients in certain circumstances to get a second opinion. And Dr. Paludo, as a healthcare provider, what are your thoughts on patients getting second opinions?
Yeah, absolutely. I think, with any rare disease, of course, Waldenström's is a rare disease. I think, a second opinion should always be something to consider. Diagnostic parameters, treatment options, follow-up testing, surveillance, things like that, they're usually not as well established in rare diseases. More than what they are in more common diseases or more common forms of cancer, like breast cancer, colon cancer, for example. I think that's one point where a second opinion can help. In addition to that, just that experience, familiarity from the physicians with that disease or the current evidence and data, the disease can be quite variable. It's just part of reality. We just can't keep up with all the information that is generated in every day for all diseases. So seeking an opinion with someone that has more experience or more interest in that specific type of rare disease, I think is very important, and just add a lot to the treatment and management. And I think, I always encourage second opinions. To be honest, most patients that I see with Waldenström's, I'm the one giving the second opinion. But for those uncommon patients that we see that are local from where we are here in Minnesota, I usually encourage, asking for another opinion elsewhere, just to have different points of view. I don't think a second opinion would ever hurt a patient. I think it can only add information and only help with the treatment and plan.
That's a good point. And hopefully they're not trying to juggle three different opinions and figure out, okay, which one do I go with? But I guess in Lisa's case, it was the one that she felt more comfortable with, which is appropriate.
That's a potential downside of it, but I think the benefits of second opinion outweigh that risk or the downside.
I was just going to say, it's with Waldenström's, in terms of it being a cancer, it's so different because the time to treatment is, you really want to time it perfectly. You really want to take into account your quality of life. With a lot of other cancers, there's a rush to treat, and there's a very specific treatment regimen that's non-negotiable, right? And I feel like with Waldenström's, you're playing a very long game of chess, and you want your partner in that to be someone that you trust, someone that understands your quality of life, your age as you're moving along the life course of treatment. You're going to want someone who's partnering with you that understands you well enough and to keep pace and who has similar philosophy and approach to treatment. It's really important to select, when selecting an oncologist, that there's a really good fit, I think, with Waldenström's in particular, compared to other cancers or other diseases.
So then, in your case, how did you know where to go for a second opinion? You mentioned Dr. Gertz's presentation, but how did you figure out, what your options were?
Yeah, I think that, having the resources from IWMF, from, immediately pointing to Dr. Gertz and understanding Mayo Clinic's philosophy led me to Mayo Clinic and looking into physicians there. Of course, immediately I found Dr. Paludo in relation to Waldenström's and others based on other aspects of Waldenström's that were particular interest to me. And so that's how I arrived at immediately finding Dr. Paludo and seeking Dr. Paludo out for a second opinion, because I seemed to resonate more with the philosophy of Mayo Clinic. They seem to have an approach that is slower to react or overreact. And the Mayo Clinic's approach feels more strengths-based to me rather than fear-based. And I really personally respond to that. When I'm, needing to embark upon a really intimidating treatment like chemotherapy, I want my partner to be able to reassure me that I'm strong enough, that I've prepared enough, that it is the right time I don't, and I understand that people have different motivations for treatment or starting treatment. And some people can be motivated by more fear-based approaches, or we're really nervous about these symptoms, it's really time for treatment. I personally don't respond well to that. I respond better to just a strengths-based approach and the reassurance that all my questions are answered, that there's enough time spent understanding the procedures or what's happening with my progress or disease. I find more and direct information very reassuring. I have had, oncologists that just take a different approach where they feel nervous about me and my condition, and then I start to feel very nervous and anxious, and at the same time feeling like, but I know that it's best to time this correctly and maybe wait a little bit longer. So I think it's a fine line, and there's different cancer centers can appeal to different types of people, and Mayo Clinic and Dr. Paludo they were just the perfect fit for me.
That's great. And Dr. Paludo, obviously you mentioned that you get some patients come to you initially, others come to you for second opinions. And if you are telling a patient, if you want to get a second opinion, where do you direct them to? That's the one part of the question. The other part is the patients that come to you, how often, or what's the prevalence of how they found out about you in the first place?
Yeah, that's a good question. So I do also rely a lot on the IWMF resources to help patients make a decision on where to go next. I mean, as you were alluding before, there's so many differences as far as insurance coverage, cost of travel, things like that. And they are so particular to each patient that is often difficult. And I try not to be very specific, more to say, here are resources that you can look at, and see which one makes more sense based on insurance, cost, travel, timing, family members, where they are, for example, things like that. As with most rare diseases, it turns out that you find some you find more experience usually in bigger centers just because they tend to see more patients with rare diseases. Doesn't necessarily mean that's the only place you can find experience and expertise. It's just the more common places where you can find expertise for those rare diseases. And I really think that's where the IWF kind of helps a lot, is kind of pinpointing, here are some of those centers or areas that may have more expertise or experience with Waldenström's than other sites.
Thank you. Yeah. Obviously, my involvement with the IWMF, I'm well aware of what services they provide, and they do have on their website a list of top doctors to go to get a second opinion, regardless of what part of the world you're in. And we also have, or the IWMF also has online discussion groups and Facebook groups where you can, ask other patients, who do you go to? Granted, that's word of mouth from one patient to another, but still you can at least form an idea of, who are the more noted doctors that you could go see if you want a second opinion. Then another question is, in your opinion, Dr. Paludo, as a second opinion doctor, what do you see that maybe some initial healthcare professionals don't get the right idea about a WM patient? Maybe they misinterpret something and are guiding the patient in not an optimal way.
Yes. I mean, Waldenström is such a unique disease that I think, the biggest challenge that I see is often related to indications to start treatment. With uniqueness of this disease, with overlapping features between other indolent lymphomas, myeloma, sometimes I see more of a generalization of what we do for similar diseases applied to Waldenström's, which doesn't always kind of fit with our best practices for Waldenström's. I understand where they come from, but I think that's often what I see the most, is about that indication for treatment question and aspect. Sometimes it can be difficult for a provider they haven't seen a lot of cases, to sit tight on a patient that has a very high IgM level and hold off on or hold back on doing something. It's often easier to do something, but sometimes it's better if we don't jump into specific tests or treatments and just sit tight and watch very closely when patients are asymptomatic, for example, or not having significant symptoms.
Thank you. Yes. Yeah. I hesitate to say this, but I remember back in the early days when I was first diagnosed, there was something called the 10,000 IgM Club. There were a handful of patients that actually felt that I'm okay, I feel fine, I have 10,000 IgM, but my symptoms are fine. In hindsight, that may have not been, but every patient's different. But you're exactly right. It depends on your symptoms and how you're feeling, along with the blood values. And it's really critical to go to a specialist if you can. Let's kind of turn now to the important role of the doctor-patient relationship in managing your disease course, both short and long term, especially with regards to WM. It is considered incurable, but now with the more novel agents that have come around in the last 5 or 10 years, it's very much more treatable. So for Lisa, when you were looking for a second, you mentioned your path to getting a second opinion. What advice would you give to a newly diagnosed patient who's looking for care, and what do you think is most important?
Yeah, I mean, I think what we're talking about here is building rapport. It is, you have to be able to trust your oncologist 100%. There are some scary moments, and you question yourself, and to have the reassurance of an oncologist that has expertise in this area, that really gets you, has a sense of how you're, uniquely, your disease is manifesting. Every WM patient is a little bit different. And so a physician that you can trust, that really sees you and that you can trust. And sometimes that's not something tangible. It's what occurs during a conversation, kind of a sense that you feel, shared, kind of insights or philosophies. And with Dr. Paludo, in my visits with him, he would ask me, and what else? And I loved that. He always left room for all of my questions. And he was always very direct with me. And so my advice would be to do your research, understand what it is that you want in terms of your quality of life, what's important to you. For example, I was going to start a treatment under the care of a different oncologist that would have put at risk my ability to dance ballet on point, so on my toes. So there was a higher risk of peripheral neuropathy with that particular treatment. And at my age, I thought, well, the first treatment I should do perhaps shouldn't be this one. And I was able to have that conversation with Dr. Paludo and talk about these things that are important to me. I know for oncologists sometimes, and rightly so, it's so understandable. Oncologists, they see a lot of different patients, and their first priority is, let's just save your life and get you treated. Can we just do treatment already? And I get that, but with WM, it's a little bit different. And so my quality of life is being able to dance on point, on my toes, and losing feeling in my toes was a big deal. And it would have negatively impacted my quality of life had I started off with that particular treatment, and if I had the unfortunate side effect of being unable to feel my toes. And so that was really important to me. So just really understanding who you are as an individual, what your quality of life is based upon, what's important to you, and finding an oncologist that understands that and that you feel comfortable sticking with, because throughout the course of your life and mapping out a course of treatment that's going to work for you. And I remember one time Dr. Paludo said, you're probably going to have to do all the treatments. So, we just got to figure out, what works for you when, and everyone's different. So I think that's really important.
So in terms of, now you have a good rapport with Dr. Paludo. Do you still see a local oncologist in Texas? And is that the same person you went to initially?
No, I still see Dr. Paludo exclusively. I was scheduled for treatment somewhere else. I had my chemotherapy, sessions scheduled, and I really got cold feet at the last second. And I thought, you know what? The first step in treatment is so critical. It impacts the next move and the next move and the next move. Even though those moves are spaced out, hopefully many years apart, it still is, sends off a ripple effect. And I just think this first step is so critical. You really want to feel very comfortable with your provider. And the institution you're receiving care from. It's just critical. And I just had to advocate for myself and say, I know this doesn't make sense to seek treatment in a whole different state and to get my primary care from an oncologist so far away. But we're going to Minnesota.
Okay. And then Dr. Paludo, obviously, you're at the Mayo Clinic in Rochester. It's a world-renowned medical institution. But, hopefully many people with Waldenström's also understand that it's world-renowned for Waldenström's macroglobulinemia. And out of curiosity, can you say how many patients you maybe see a day or in a week that have Waldenström's?
Yeah, absolutely. I mean, it's really variable these days, but I think I could estimate about 2 to 3 patients a week with Waldenström's in my clinic, sometimes as many as 5 patients in a day. To give some context, for example, we look at this a few years back, and if you were to consider all hem-onc doctors that are practicing in the U.S. and all new patients diagnosed with Waldenström's in a year in the U.S. If we were to kind of spread that out, each doctor will see a new case of Waldenström's once every 8 years, just to give a sense of kind of how rare diseases are sometimes, very, very difficult to come across.
Okay. And obviously, you and Lisa have a very good relationship going in terms of doctor-patient relationship. In your experience, also, are patients different? Does each patient approach you differently, or do you have a different approach depending on what kind of interaction or what works best for that patient?
The approach is different for each patient. Essentially, things that we always try to discuss and to focus is usually focus on the main concerns that each patient brings to the visit, which can be different. If someone was just diagnosed with Waldenström's versus someone that already has reviewing, studying, researching, and now we're talking about treatment. So there are some differences in kind of how we approach and try to establish that, but it's often kind of focused on addressing the main concerns for each of those visits and each patient.
And thank you. And given that Waldenström's is becoming more of a, let's say, manageable disease, when people come to you and just like Lisa said, you told her that you'll probably have to take all of these treatments at some point. What is your guidance to patients when they first come to you as far as how to deal with having a disease like ours, where you have those periods of requiring active treatment and periods of watching and waiting for the next shoe to drop, in a sense? Not a ballet shoe, but
it depends on the situation, but I'm always trying to discuss some of the key concepts related to Waldenström's. We talked about follow-ups, treatment indications, things like that. They're important and they're unique. I like to address that usually because that is important for the patient, especially if they're not coming to Mayo for their longitudinal care. So at least they have some idea of those things that are important. But as Liz was mentioning, at the end of the day, we're always trying to kind of have establish that trust and an open space where I want the patient to feel empowered, that they can ask any questions, no matter what that is, and bring up any concerns, any fears, or anything that are important to them, which, sometimes it's difficult to do in one visit only, although we do try to put all of that in one appointment, but sometimes we do need several visits to discuss all of these ideas and concepts and questions.
That's thank you. Yeah, that's very commendable. Obviously, that should be the model for all clinicians. Unfortunately, a lot of them are pressed for time or dealing with a large patient load and just don't make that extra effort. And you should be applauded for doing that. And with regards to for Lisa here now, obviously you had some choices to make with regards to treatment. Were you aware of the treatment options before you spoke to Dr. Paludo?
Oh, yes. In fact, the second oncologist I saw for what was supposed to be my first treatment opinion, I started talking to her about the treatments and she said, "Gosh, you sure do know a lot about this. What do you think?" So I basically didn't get my first opinion that I was hoping for because I had done so much research that the oncologist I saw initially just really felt that maybe I had a better sense of what treatment I should start with first, which ultimately led me to going back to to a second opinion with Dr. Paludo. Yeah, I had done a lot of research, which I enjoy doing anyway. Of course, it's not a situation you want to be in. But like I said, I work in public health and public health strategy. So strategy and research are things that I enjoy doing anyway. And I wanted to find out as much as I could about the treatment options. It's not always clear, I would say, from the scientific papers, actual patient experiences. And I think that's something that is missed in very scientific journal articles, that can only be shared through patient-to-patient experiences. And with Waldenström's, that can be additionally challenging because we are each so unique. It is a full body disease, and it manifests differently. The symptoms are different person to person. And being a female too, there are fewer females with the disorder, fewer people my age. So it can become more difficult, even though you do a lot of research, to really know exactly what to expect is impossible.
Okay, yes, that's a good point. And so initially, obviously, you did a lot of research, but emotionally, how were you dealing with it? How did it affect you from that perspective when you were first diagnosed and dealing with the enormity of it?
When I when I was first diagnosed, I was really shocked, and I remember my daughter. You know, I just couldn't face her that day. I knew I couldn't have the conversation with her that day, and I wear my emotions on my face. So she had a sleepover that night. After that, I would say I felt somewhat calm about it, even though I do have a history of anxiety disorder. But I knew going into the treatment that my outcomes would be better if my anxiety was reduced. I know that stress plays a huge role in your physical health in general, but I imagine especially as you're undergoing something as stressful as chemotherapy, where you have a lot on the line. And so I really made sure to keep up, my mental health care with exercise. I have a therapist I see weekly. And most of all, I think what reduced my anxiety was talking to Dr. Paludo about specifically being really vulnerable about points and parts of the treatment that I thought were most concerning in terms of my anxiety, and also history of eating disorders. I was able to talk in depth about how I was concerned about a recurrence of my anxiety and eating disorders in the course of treatment. And Dr. Paludo was able to reassure me that at any point in time, if I was having concerning symptoms, that we could talk about it, but most of all, that we could always stop treatment and take a different course of action. Knowing that I had that option was never presented to me before by any of the oncologists I had seen before. Just having that way out and knowing that I had that autonomy was so reassuring, and it really helped me to get through a lot of rough times, throughout the course of treatment. I think I had a pretty good treatment experience, but everybody has some scary moments throughout the process. I'm not going to lie. It wasn't, it wasn't always easy, but it was a lot easier knowing that I had the support of my oncologist to pivot and redirect and find a different course of treatment that worked better for me, and that my quality of life was most important to both of us. So that was the most reassuring part, and I think the part that really helped me keep my mental health in check.
Great. Yeah, that focus on quality of life is really critical. And you're right, every patient's different, both physically and mentally. And it's important to treat both aspects, how a patient approaches their disease. And Dr. Paludo, kind of to build on that, when you see a patient, especially when they first come to you, you have that long conversation with them. What do you want patients and care partners to take away from that initial visit with you? What do you want to make sure that they understand what they should do or how they should deal with their disease?
One of my priorities are usually to have patients understanding that treatment for Waldenström's is really not a sprint. It's a marathon. It's a long-term process, a long-term planning. You really have to consider all those short and long-term strategy for treatment. And as Dr. Ramirez, Ms. Ramirez mentioned, I usually say that when you're getting a treatment, if you're not in a long-term commitment with the treatment, you can always stop and change and find a different option and strategy. I also like to discuss, usually in broad terms, the point that at least what we have today for treatment options, that they all have an overall similar efficacy. They differ, they are different in potential side effects, in the logistics and duration, frequency, all of those things. And I think that often kind of opens the door or allow patients to focus on the implications of the treatment on their quality of life and their goals. But I think once we remove that efficacy piece from the discussion, we can talk more about side effects and logistics. You can really focus on what treatment, how the treatment can help patients achieve what they actually want at the end of the day, which is improve quality of life and accomplish their goals or what things are important to them. So I think those are things that I always like to have patients take from those initial discussions about treatment options before even we decide on which treatment to go next.
Thank you. Yes, and kind of build on the quality of life issue. And this question, first I'll start with Lisa, and then I'll come back to you. But with Lisa, you mentioned, that you wanted to make sure you had a good quality of life. After you were diagnosed and after you started treatment, did you do anything different? Did you change certain lifestyles or take on new interests or anything along those lines to kind of help you emotionally and physically?
Absolutely. I think Dr. Gertz said that frailty is the enemy with this disease. So I immediately got a personal trainer and I hit the gym. I thought this is, people train for marathons. This is the rest of my life, right? I don't want chemotherapy to knock me down. I need to be as fit as possible. I'd also participated in an educational session through the Leukemia and Lymphoma Society on nutrition. And I also met with a nutritionist. And so I changed my diet to reflect some of the recommendations based on those talks. So slight changes to eating more of a plant-based diet, and really building up my strength to approach treatment, knowing that treatment was inevitable and that it was coming and I needed to train. So I did that. And I think ultimately, and like I said, I saw a therapist weekly, and I think ultimately, it really, really helped. I mean, during chemotherapy, I didn't really miss any work. I remained very active. I was still able to dance. I was not allowed to skateboard anymore. So that was on the can't do list, but I did still dance. I did still, get out there and I was jogging as much as I could and, exercising as much as I possibly could to fight off the fatigue. And it really paid off. It really did. And I think that makes a big difference in terms of how one feels during, the course of treatment and your ability to be resilient and to make good progress in treatment.
Thank you. Yes, I agree completely. It's important to move. A lot of patients say that, their treatment has debilitated them, but I try to tell them, at least move a couple feet, a couple steps a day, and build on it every day. And it does make a difference. And so for Dr. Paludo, do you have any follow-up advice for patients on living with Waldenström's, to deal with quality of life issues? And another possible question could be something similar, like, can they continue to live like they did before they had WM?
Yeah, absolutely. I think, it's always difficult to cope with a new diagnosis of any cancer, including Waldenström's. And I think every patient is a little different on how they can try to cope with that. What I usually try to do is to try to understand things that are important for each patient and to focus on what they can do to control, what they can do, it can control what they do with that. So with Lisa, dancing was very important. So we couldn't control when treatment was needed, but we could control that she could continue to dance, and that would be a form of exercising that helps with kind of a coping, and also tries to help keep some form of normalcy in life. Life can be disrupted with diagnosis and treatment, so trying to keep as much of a normal life as possible when you're going through treatment or after diagnosis. I think that's very important, and I think it is very possible, especially as you're going through that watch and wait period with Waldenström's before treatment or between treatments. I think a normal life or life as before, as much as possible, is something that can be done. I also, to be honest, I am not an expert in mental health and coping, so I do also look for help. I do refer my patients to cancer therapists, cancer psychologists. Yeah, team here, we have a Mayo to help with that. I guess I try to play within my limitations and always look for help from others that know more than I do about some of these topics that are very important for every patient.
Thank you. That's a great approach. And Lisa, obviously you've advocated for yourself right from the start. What would your advice be to newly diagnosed patients who are going through it and possibly even in remission? What's your advice to those patients?
Yeah, I would say for newly diagnosed patients, get connected with IWMF. I was so impressed with the resources available for such a rare disease. It's honestly very impressive how well IWMF is organized. And if you're a young person or under 50, it can be more challenging because it's almost a different disease or different considerations. Also, when you have kids, there's a lot when you have young kids at home, there's a lot of different things to consider. And so getting connected with the IWMF support group for young people was helpful. Finding support with people in your community. And I would say watching the lectures and all the resources, reading all the resources available sooner. You do have some time, to figure everything out. If you're newly diagnosed and you don't have symptoms that are requiring immediate treatment, which is good. So you do have that time to do the research. And it's just really necessary. I would say also looking at the different cancer institutes that have different philosophies and finding this when you're listening to lectures from different experts, just finding who resonates with you and what makes sense to you. Who are you listening to in these lectures or in these papers that you seem to align with in terms of what feels right for you, what you value. I think that doing all that, taking time to consider all that is really important so that you can locate the physician and your team that you're hopefully going to be with for the rest of your life, right? Periodically working on, achieving just a really good quality of life while living with this disease. So I think that's just really important to really take in all the information, talk to your supports, and really connect. And if you feel that, I thought at first that having Dr. Paludo as my primary oncologist was not possible. But you may be surprised at what is possible. So I'd say have hope and advocate for yourself.
Great. That's great advice. Obviously, you approach each appointment with knowledge beforehand, and you do your research, and you are self-advocating. Do you go to your appointments on your own, or do you take a care partner with you? Sometimes you read that, someone should always have someone else because you mishear something or something along those lines. How do you manage that?
Well, I have a great partner and support. I think you're absolutely right. Sometimes it can be overwhelming. I noticed I would go to some appointments with a different provider and I'd walk out sweating and just noticing I was so nervous during that appointment. And so having someone there can be really helpful. When I went to treatment, my partner would go with me. One time my sister went with me, and sometimes you get disappointing news. I oddly got disappointed that I couldn't do chemo a couple of times, and I got really upset and emotional about that. So to have an emotional support person with you is really helpful. It's much better not having to do it alone. But if you are alone, there are people that, are there to support you. Like I said, at Mayo Clinic, there's a whole team of people. I mean, I was joking with the chemo nurses, do practical jokes, and everybody there is really supportive. And so you can do it alone. It's great to have an external brain to also process the information, and then to also reflect back to you. Maybe you don't even notice that you're not feeling comfortable with a certain provider, just to kind of bounce off. Did we hear the same thing? Does this feel like a good fit? I think that's really important to have someone with you.
Great. And Dr. Paludo, what's your advice in that regard? Do you feel that most patients come with someone when they come to the appointment, or do you kind of suggest it to patients if they don't?
Yeah, I think most patients come to the appointments with someone else to help. I think that's very helpful. I think that's very important, if possible. Of course, it's difficult sometimes to take people away from their normal day-to-day lives and things, but I think it helps to have someone else also listening. And remember, we usually don't remember everything that it's discussed. So every person remembering one part of the discussion, it usually helps at the end. So I usually encourage that if possible.
And Lisa, of course, you've been very proactive. Kind of a follow-up question to that is, obviously you've been living with Waldenström's for a few years now. How do you not let Waldenström's consume your everyday life, or do you not let it consume your everyday life? That's probably assuming that you don't. What's your approach to living with it?
I think in the beginning, it was difficult to not let it consume my life. For me, planning out a whole theoretical course of treatment to last my whole life was helpful, right? To know that, okay, for me, charting out early on, on average, this treatment should last about this long, until I need treatment again. And then knowing, okay, if I map this all out for my entire life, just having that plan in place, also having a plan in place when I didn't have symptoms, or symptoms that were bothersome to me. The night sweats weren't too bothersome for me. So, and I had anemia. And so I had to decide when to start treatment, just making decisions in advance. This is my line in the sand. This doctor says this doctor says this, I'll meet them in the middle. This is my number, right? To have those things mapped out in advance allows me to trust the plan and not have to think about it in my daily life. Once those decisions are made for the future, I can always change my mind at any point, but just to have that mapped out for myself allows me to forget that I have Waldenström's and just live my life. It might take a minute to get there. So at first, after diagnosis, it is consuming. You are, consumed with the research. I would say just don't overreact. Take your time, talk with your oncologist about a plan, put a plan in place, and then put it aside and live your life, because ultimately it's what treatment is all about, is having a good quality of life and living your life normally. And you want to be able to do that and not add any additional stress to yourself. And so putting a plan in place, putting it aside, and referring back to it when you need to, I think is really important.
Great perspective. Thank you. And Doc, basically, so obviously right from the start, you had a good relationship with Dr. Paludo. How has that evolved now over the past few years? Is it different now than it was initially?
Are you asking me?
You can say nasty things about him if you want to. Yeah, I'm asking you. Yeah.
No, I would say Dr. Paludo has been very consistent. I mean, initially when I think I met with Dr. Paludo before I even met with who I thought was going to be my primary oncologist, and then the second person who I thought was going to be my primary oncologist. And I remember I walked away from that conversation saying, gosh, I met the right oncologist for me. Too bad I can't possibly, get treatment in Minnesota. And so I would say that I knew it felt like a good fit from the beginning. And we've just built upon that trust. I instantly felt comfortable. I instantly felt trust. He engaged with me in a way, like I said, that was strengths-based and not overreactive. He's very steady. And so I would say our relationship hasn't changed much other than we've been through this treatment together. And I think, there's, a deepening of trust there now. And I've talked about my next treatment episode with my partner, and I'm like, well, if I have to do the weekly treatment at some point, or when we have to do that, we're just going to live in Minnesota for 6 months. and there's no question about that. Dr. Paludo is I know he's here for me, and he's my oncologist, and until the end. So I feel very comfortable with that.
And if we need to move to Minnesota, we'll try to avoid the winter for the treatment. We'll pick summer.
Yes.
That's right. Good point. So Dr. Paludo, do you have any key takeaways for maybe patients or healthcare providers in building and sustaining a strong relationship through the cancer journey, as obviously you and Lisa have?
I think, Lisa has already summarized everything, right? She has said everything. I think it's important for us to listen very carefully to all the points. Things that I can highlight or summarize from what I heard in the last hour is, one, for patients is to advocate for yourself, to go after and seek what you think is important for you, right? And I think for the healthcare providers, from our standpoint, what I've heard, and I think is very important, of course, Lisa and I are on the same page with all of this, right, is to really actively listen to each patient priorities. That's very important, to actually listen, not just hear, but to pay attention to it. To also focus on what is important for each patient, their main concerns, fears, everything around that. And also, I think we as providers, we have to be frank and honest with the limitations of what we know and what we don't know about Waldenström's. There's a lot of things that we know now that we didn't know before, but there's a lot of questions that we don't have an answer yet. I think being honest with our limitations, paying attention, and focus on what is important to the patient, I think that's kind of what helps build really that trust that is important in a relationship when we're all going together through different moments, good and also good moments in this long journey of Waldenström's. That's kind of what I think is important and I want to highlight. But honestly, I'm just saying what Lisa has already said, throughout the last hour in our conversation.
Thank you. Yeah, I agree. It's good to see you're both in agreement. Obviously, you're both following the proper path, and I applaud both of you, and especially for taking the time out to share your experience with others, healthcare providers, and patients. Lisa mentioned that she first did a good bit of research with the IWMF. I did that myself 20 years ago, and I was a youngster back then, and the services they provided and the support they provided meant so much to me that I started volunteering myself for the organization, and I've been with them for that since then. I found the communications with other patients. It's a rare disease, so you don't encounter many other people that have it. So finding an online community was of great benefit, and sharing stories with them, joining support groups, taking part in their discussion activities, viewing webinars like this, going to their annual Ed Forum. All of those are key components of becoming a more knowledgeable patient, so that when you go back to, I remember in the early days, this was before the technology that we have today, I would have my own chart that I would give to my doctor and say, here's my trends. And he would laugh at me, but he would look at it. So that's important, I think. And we had a great relationship. And that's really important to have that, to be educated about your disease, to know your options, to know what your lifestyle is and what your preferred lifestyle and what you want in quality of life. And then pick a doctor that fits well with what your idea is of what your outcomes should be. I think both of you spoke very eloquently about that, much better than me, but I'm trying to kind of hit the high points here. And I really appreciate everything both of you have said. Do you have any other maybe final notes on key takeaways you would give to a patient, or to start that patient-doctor relationship and maintain a very strong one? Maybe we'll start with Lisa and then Dr. Paludo.
All I have to say is my therapist thinks Dr. Paludo is great. she wonders if he took.
We all do.
She's convinced he took some sort of classes in psychotherapy, and she's got great admiration for him. And I'm also trained as a therapist too. And I would say Dr. Paludo has those skills, but please don't leave the work you're doing to be a therapist, although you'd be a great one. I just think listening, seeing your patients. And I know Mayo Clinic is huge, and you walk into this place, and I kept, after every visit, I thought, how is it possible that each person on my care team was able to spend that much time with me? I've never encountered that anywhere else. How is it that nurses remember me, people remember me? We had little inside jokes. It's those things that matter so much. And I know that, our healthcare environment is changing, and there is a limited time with patients. So really, I think we're speaking to healthcare institutions, and I don't know how providers get reimbursed and expectations in general. I think physicians want to have these kinds of relationships with their patients. And maybe there's just a larger pressure that prevents them from doing so. And I hope that we can get back to that. And institutions like Mayo Clinic and physicians like Dr. Paludo give me that hope that it is possible to have those kinds of relationships with patients in the current healthcare environment. Somehow it's possible.
Dr. Paludo?
I don't think I can say any better than Lisa has already summarized. I think it is important to keep in mind of what is really priority, right? Is the individual, is the goals, is what really matters to that patient, that person, as far as quality of life. I think that's kind of always try to keep that in mind. That is really the goal at the end of the day. But that'll be my takeaway point, and just not to repeat what Lisa has already said, but because we're in complete agreement.
Thank you. Thank you to both of you. I really enjoyed this discussion and conversation. It's always good to meet with a fellow WMer and also a noted, world-renowned Waldenström's clinician and researcher. So very grateful for both of you for taking time out of your days to speak to everyone. And I hope others find this information, much as I had, very useful and beneficial. Thank you.
Great to meet
And
you.
thanks to the folks at
Thank you.
Patient Story.
Thank you.
Thanks.
Thank you to our moderator, Pete, and our special guests, Lisa and Dr. Paludo, for an engaging discussion. To wrap this up, I want you to leave with the important takeaway that it is so crucial to be empowered so that you and your caregivers can make those informed decisions about your care. A reminder, we want to hear from you. A survey will pop up when this program closes, so do not go anywhere just yet. Thanks again to our sponsor, Pharmacyclics and AbbVie Company, for its support of our independent patient program. And to our partners, LLS. Make sure to check out their website, particularly their Information Resource Center, which provides free one-on-one support. And the IWMF, who has over 60 peer support groups worldwide to share experiences, discuss concerns, and exchange information. Until next time, I'm Tiffany Drummond signing off. And on behalf of the Patient Story, thank you for watching.